In this video, I will cover our new and unique process to help fix chronic neck pain without using medications or injections. Expect to learn the following: what causes degenerative disc disease, what causes constant tension and tight traps, what causes tension, numbness, tingling, and burning in the neck and head, and our new and unique treatment process that helps fix chronic pain naturally. My name is Dr. Matt Maggio, and I am a soft tissue injury treatment expert specifically for chronic headaches, neck, and shoulder pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain without the use of drugs, injections, or surgeries. This leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. So I make these videos for anyone that's in chronic pain, been lied to, overpromised, underdelivered by the current medical model, not really getting any answers, and want to use it as like a tool or a guide for a potential client to watch if they're in pain and kind of get a different perspective about our unique and really just different treatment process, especially when it comes to chronic neck pain. One of the most common causes of neck pain is what's called degeneration, specifically to the discs and the joints in the neck. So what is degeneration itself? It's really just a general term that things just kind of wear out before their time. A lot of times people end up getting an MRI and they'll see disc degeneration. They'll see like a bulge, a herniation, a protrusion. They'll see like arthritis in the joints itself. So why does this happen? Basically, over time with bad posture, sitting too long, chronic just stress, maybe some accidents and things like that, you really start to stretch the ligament that runs up the back of the neck. And this ligament is called the 𝘞𝑡𝑡 ligament. And you can see pictured here, it's a really big ligament, and all the muscles in the back part of the neck, they actually connect to that area and they use it for force production to start moving. And over time with bad posture, where your head's down all the time, maybe you're stressed and your traps are up through here, that ligament gets constantly stretched. When it gets stretched, it doesn't get enough blood flow, it doesn't get enough oxygen, and it starts to develop this stuff called adhesion, also known as scar tissue. And then it gets inside there and really makes the ligament less flexible and weak. Then what happens is the ligament can't do its job, which is to actually support the joints and the discs and the muscles around there, and it puts more force there. So now the force starts to go to the discs and the joints themselves. So basically what happens is, think of the disc and the joint that has degeneration as like a thumb stuck inside a car door. The car door is all the adhesion and scar tissue around there. You can't give this a chance to heal up until you free that. So a lot of people jump to surgeries or injections to try to address the disc degeneration itself, but a lot of times it's the effect, not the true cause. So getting to the root cause of what's going on is starting in the ligament and cleaning that up, and makes a big difference in just allowing some pressure to alleviate on that degeneration, because I'm seeing more and more in my practice that a lot of the pain itself isn't directly coming from the disc degeneration, it's from everything else surrounding there, so we have to address that first. Next cause of chronic and unresolved neck pain is just tight traps. Everyone has pain in the traps. It's probably the most common area in the entire human body to just have tension. People will go at so many different ways to fix it. They'll stretch it, they'll roll in a lacrosse ball, they'll get deep tissue massages, they'll get adjustments, and it continues to just come back. Essentially what actually happens there is there's a nerve that comes out right behind the ear and it makes its way down. You can see here in the photo, it's called the accessory nerve. And the job of that nerve is to actually move the trap and this big muscle in the front here called the SCM. But over time, as I talked before, with that bad posture, stress, chronic pain, and just the muscles always getting stretched and contracted, they develop a lot of that adhesion and scar tissue. But then eventually what happens is that nerve gets stuck. And when the nerve gets stuck, it creates tension, burning, all sorts of problems. And what happens is when the nerve is entrapped in that area, it really causes everything around there to tighten up because it wants to protect the nerve. If the nerve is stuck, it's compromised, it's gonna, roll your shoulder forward, hunch your neck up just like that because it's trying to take the pressure off of there. Now, when actually getting this area fixed, It needs just the right amount of depth and the right amount of tension. A lot of times when other providers find it, they're very aggressive with it. They might use their elbow. They try to do like a deep tissue type of work. The chiropractors think that it's tight in there because the joints aren't moving. But what's happening is that nerve is stuck. It has to get just the right amount of depth and just the right amount of tension. And a lot of times when people treat it, they're actually treating it way too aggressively. And it kind of hurts like hell when they're getting it treated. And it feels good for a little bit, but it actually never actually fixed the problem. And that's why it continues to come back. So you can do all the stretching, all the rolling, all the deep tissue massages in the world and get all the adjustments. But the nerve actually has to get treated very precisely and very focused. And that's what we do in our treatments is we're very focused, very precise with what we do. We get just the right amount of depth, just the right amount of tension. And then we're able to have the client go through a full range of motion as we're holding pressure and tension there. And that actually breaks it down. And when you free that nerve up, everything else around there can relax and take some pressure off of there. Then the traps drop. Things start to feel less tension, just move better. And it's a longer lasting type of treatment. The last cause and most common that I see of chronic neck pain, and it's really, it presents with this idea of like tension, numbness, tingling, burning into the neck, into the head, and even down into the arm as well. And as I said earlier with the accessory nerve, what else happens here is all the muscles, especially around the side of the neck, called the scalenes, they get stuck to all these nerves that come out. And you have all these nerves in your upper body that have to control your entire upper extremity and a lot of the back part of your like shoulders into your neck as well. Those nerves get stuck. And when they do, it gives you like that pinched nerve feeling. You know, people are like, oh, I pinched a nerve, or like things are just really tight in there. But what happens is it's getting stuck in these muscles called the scalenes. And there's three different groups in here. There's one in the front called the anterior, then there's the middle and the posterior. And a lot of times it either gets caught between the anterior and the middle, or the middle and the posterior. And when it does, it gives all that sensation of tension, numbness, burning, a lot of just problems in there as well. Now, as I said with the accessory nerve, same thing with these nerve roots at the scalenes is when providers do find them, they're usually too compressive on them. They just go in there and kind of jam on there. Temporarily feels better. Doesn't feel great when you're getting it treated, but then that pain continues to come back because that nerve is continuing to get stuck. The body wants to protect the nerve at all costs because if the nerves are compromised, then everything else doesn't work. So it sacrifices a lot of things, puts your head in weird positions, elevates your shoulders, causes all sorts of problems. Now, the key is getting in there very precise, very focused, and that's exactly what we specialize in treating. So if you've been dealing with chronic neck pain for at least 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us and request a no-charge injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief so you can stay away from the medications, injections, and the traditional medical model, which only make things worse. All the information to request a consultation from a Peak Method trained provider is in our profile or wherever you're consuming this video. I appreciate you watching, and we'll see you on the next one. Bye.